Here's a question. Is there anything that wearing a mask can't accomplish? The answer appears to be no. According to a new study in the prestigious New England Journal of Medicine, not only was kids wearing masks in schools the right call, but masks can also prevent racism, meaning kids should be wearing masks in the classroom forever. For more on all this, let's bring in internist Dr. Frank Contacessa back with us on this Tuesday morning. Dr. Frank, good to see you. Good morning.
Morning, Ron. Nice to be here.
Good to have you back. Quite a study. The authors of this study also concluded that, and this is a quote, universal masking may be especially useful for mitigating the effects of structural racism in schools, including the deepening of educational inequities. Can you please attempt to explain the science on that one for me?
Well, Rob, I can try. So I'll tell you, reading this study really made my head study, and I had to read it maybe 2 or 3 times to even try to understand what they were trying to get across. So to me, my brain separated this, the issues with this study into 2 separate things. So number one, there's the science that they presented of did masking and mask mandates in schools make any difference at all with transmission? They allege that it did, and maybe it cut down on a few cases. We can debate that. But then the discussion section of this study read more like a sociology textbook than a scientific study. I've been practicing almost 20 years. I've read a lot of studies. And this is the New England Journal of Medicine. This isn't some second-rate publication. It's the New England Journal of Medicine. And what they're trying to say is that the school districts that saw a greater improvement from the masks tended to be ones that were poorer and had fewer resources, larger class sizes. It was so convoluted. Again, I had to read it 2 or 3 times. And they actually conclude, they don't even suggest, they conclude that masking can improve the structural racism, whatever that is, in these neighborhoods. And I still can't really figure it out.
Yeah, I agree. So I read this and I was waiting for the payoff pitch. Basically, if kids wear masks, they won't be racist because the masks do, and they never delivered. They never really brought it home. And again, to your point, the New England Journal of Medicine, there might not be a more prestigious medical publication. Not anymore. What does a study like this do for the credibility of the medical community, which right now is hurting, especially when agenda-driven scientists publish something like this for people to read?
Rob, I don't think it does very much at all. And I find this attitude is building. There's concern about public health. They've lost a lot of faith and trust because of lies and things that we were told that weren't true. And if they would just be honest with us, and I try to be honest with my patients all the time, and I really think we're going to be dealing with this for a long time, the mistrust of public health that's been building when a person reads a headline like this, because they're not reading the whole study either. What they're seeing is the headline in the news that says masks prevent racism. And people say, what are you talking about? So I really don't think it helps our people's attitudes towards public health at all.
Yeah, it also supports the notion that we were talking about, a year and a half ago, that the left and people in the medical community in certain corners want us masked forever. And they'll do anything they can to make that happen. Masking prevents racism. That's the message that they're sending to people in the medical community right now. The New York Times wrote about this study, Dr. Frank. They basically concluded that this will be the first of many studies that prove that masks are effective. How big a problem is that?
I think it is a problem to base the public policy on a study like this, which has so many problems. We need about an hour in this segment to discuss the problems with this study. But I really think that's a major issue to base public policy on a flawed study like this. And for the New York Times to come out and just gush over it, we need to discuss this a little bit further. And, I just want to say one other thing. I've been practicing for a long time, and medicine has always been truly colorblind, in my opinion. I've worked in emergency rooms. I've worked on hospital floors where we treat prisoners. People, the police bring in patients in handcuffs. I don't care who comes in. When a patient is sitting in front of me, it's a human being. And I would treat that human being the same no matter what color they are, no matter what neighborhood they live in. Why are we doing this? We are separating everything into race. And I think medicine was one of the few places where a doctor was trained to look at a person as a person. And even that's changing now.
Good point. Dr. Frank, that's why we call this stuff out and have you on. Appreciate it. Good to see you. Have a great holiday.